Hello, everyone. I'm Robert Hicks with TALRadio. You know, TALRadio is essentially the information and entertainment vehicle of the Touch a Life Foundation, which is all about, it's basically a registered 501c3 nonprofit organization that is really designed to help organizations or persons that are in need to connect with organizations that would like to help them. And today we are talking with, I should say, some representatives from Catholic Charities of Santa Clara County in California. And today we have, actually, I'll go around the table here real quick, and we'll start with you, Greg. If you want to introduce yourself and your role at Catholic Charities, it would be great.
Thanks, Robert. Yeah, my name is Greg Kepferle. I'm the CEO, Catholic Charities of Santa Clara County, and great to be with all of you today. And I'd like to turn it over to Candace.
Hi, my name is Candace Chen. I'm the Director of our Refugee Foster Care Program at Catholic Charities.
And I'm Bridget Balahaja. I'm the Program Director for Parish Engagement at Catholic Charities.
Okay, nice to meet all three of you. Like I say, certainly we love to have the opportunity to meet with the people that are actually making it happen on the front lines, serving the community. And let's talk a little bit about what the Catholic Charities of Santa Clara County is. I know you're an organization that's affiliated with the Diocese of San Jose, but you're actually a completely separately incorporated nonprofit organization, right, Greg?
Yeah, that's correct, Bob. So Catholic Charities of Santa Clara County is the social justice and social service arm of the local church of the Diocese of San Jose, separately incorporated. Our focus is all about building a just and compassionate community as we disrupt poverty that's affecting the most vulnerable families in Silicon Valley. And so we work very intensively to alleviate the conditions of chronic poverty and reduce the symptoms, situational poverty, and prevent generational poverty. And we like to say we do this by changing lives for good with evidence.
Yeah, that's really interesting how you said that. And I want to drill down a little bit on some of the things you said, because there's some terminology in there that you use that some people, including myself, may not be second nature with. Things about what you're referring to as chronic poverty and how you might, some of the things you're doing to alleviate that. Tell us a little bit more about that, if you would.
Sure. As we see in this valley, there's huge income inequality. And, you know, even though we live in a very, very wealthy valley, many families are just one paycheck away, one rent increase away from becoming homeless. It's affecting especially older adults who are isolated, living on limited income, people with disabilities, and working families with children who are just on the brink of homelessness. Many of the individuals and families that we serve deal with situations like chronic hunger, having limited income, whether it's unemployment or low wages that they can't afford the high rents and the increasing cost of living. So we're seeing a situation of chronic poverty that requires us to respond immediate emergency assistance. So things like emergency food or rental assistance and housing assistance to help people survive day to day.
So how do you differentiate that just from that term that was used of situational poverty?
Sure. Now, some people,
situational poverty?
That's great. Great question, Robert. So some people that we serve may not have been poor facing a crisis until recently. So, for example, refugees, they might have been doing well in their own country until there was a war. So we'll have a conversation in a little bit about Afghan refugees and maybe Ukrainian refugees. You know, so for example, there's a crisis that happens, like the crisis of the pandemic. People were doing well until they lost their jobs to the pandemic. And that affected their income stream and they needed immediate help. Or there might be people that, because of a health crisis or a mental health crisis, ended up losing their jobs. Or because of their immigration status, needed help with immigration support. So it's a particular situation that requires, if you will, an intensive but shorter term fix.
And lastly, what's generational poverty? Is that?
Yeah. So we see,
I saw the three of them on your website.
Yep. We see in generational poverty so often that children who are born into poverty, whose parents are poor, are themselves more likely to be poor as adults. And part of that has to do with a combination of factors that living in poverty, there are poor health outcomes, there's often poor education outcomes, just the lack of income to be able to make ends meet and survive. We want to break that cycle of generational poverty. And we'll talk a little bit more about that. Part of that means focusing on the whole family, starting from early childhood development through elementary, after school programming, all the way up to employment supports, housing supports, whole family wraparound supports for self.
How long has your organization been in place? How long have you guys been at this, or others that maybe before you?
So Catholic Charities of Santa Clara County has been serving the community for over 66 years here in the Valley. This will actually be our 67th year since 1955. And we started with one social worker who moved here from Chicago, Helen Hansen,
Really?
who's a famous person in the Valley for what she's done, breaking new ground in helping immigrants, helping foster youth, helping kids in juvenile hall, helping seniors, just doing incredible work building up all the services for those most in need in Santa Clara Valley.
How many people would you say you work with sort of on an annual basis, like on average? Or
So pre-pandemic, we would say between Catholic Charities and our housing development arm, Charities Housing, we would serve approximately 40,000 of our neighbors in need.
Wow, okay.
That's pre-pandemic. With the pandemic now, and this is very conservative, but I was just getting more numbers today, we're serving over 80,000 individuals. So we've doubled the number of people that we're helping just in the last 2 years.
The pandemic has had that big of an impact on it.
What we saw were so many people were hungry and so many people were in need of rental assistance and other supports that Catholic Charities stepped up. We were asked by Second Harvest to step in and run drive-through food distributions and home delivered groceries to those who had to quarantine due to COVID, and seniors and people with disabilities that are homebound. And that has caused our services basically to double in the number of people that we're serving.
So let's talk about some of the service areas that are offered by Catholic Charities of Santa Clara County. Again, we're here with Greg, Candace, and Bridget from Catholic Charities of Santa Clara County, just taking some time to understand their organization, what they do, and how they connect with the community to provide service and assistance. We're going to talk in a little bit about how you as individuals, the listeners, can actually get directly involved with the Santa Clara County arm, or even perhaps an organization in your area that's similar. But can you tell us about what some of the service areas are that you provide? Economic security. That's kind of a big mission, but I like it.
Right. So for economic security, basically we look to provide people with jobs, so employment, provide them, especially immigrants, with access to a pathway to legal permanent residency and citizenship, enables people to get both a green card for employment as well as be more secure for longer term self-sufficiency and economic security. We've added an additional program, tax assistance and benefits enrollment assistance, so that people can access public benefits and federal tax breaks like the earned income tax credit and the child tax credit. We know from research from the federal government that the child tax credit alone can cut child poverty by 40%. So we need to let people know that they can get that access to those child tax credits and the earned income tax. So that's kind of in a nutshell, the economic security. But that's a part of the whole wraparound of all of the other services around, food, housing, healthcare, behavioral health, and education, and working with specific populations like refugee foster youth, or working with low-income families being helped through our parishes, through parish engagement.
Yeah, I see service areas that you have listed on your website. One of them that probably hits home today is the emergency programs, because there's an awful lot going on today that is an emergency. I think maybe this gets us closer to talking to Candace and Bridget about the parts of your organization that they're responsible for. But with so much going on, we look back at the Afghan refugees situation, but I didn't even think about the immediate things going on in Ukraine, where Can you tell us a bit about as you mentioned before, the refugee resettlement program and also the refugee foster youth? I don't know which of you wants to go first, but can you tell us a little bit about what those are?
Yeah, I can start with our refugee foster care program. We've been working to resettle unaccompanied refugee minors from all over the country. We're one of the Bay Area programs that operate a federal unaccompanied refugee minors program. And we're constantly looking for, warm, open families to become resource families in our program to be able to welcome a refugee or immigrant youth.
So how's that differentiated from the refugee resettlement, specifically about children, minors? Tell us about the refugee resettlement.
Yeah, so Catholic Charities has a pretty rich history when it comes to serving refugees. Obviously, Candace was just talking about our URM program, or unaccompanied refugee minors. But we also used to have a formal refugee resettlement program. And that served families and adults, and it was for a much shorter scope of time than I think what our minors get. As far as what's happening now, with the fall of the government in Afghanistan, the Biden administration quickly put together this kind of loophole program that's called Afghan Placement and Assistance. So it's not actually a formal resettlement program, it's more of a relocation program. And that's what Candace and I are co-running right now. And the purpose of that is really to help Afghan adults and families who had to flee during the fall of the government to get to a safe place and to start their new lives here in the Bay Area.
I know one key area for your organization is housing. Can you talk a little bit about that and what you're doing in housing and what people can do to get involved to help you?
Yeah, thanks, Robert. So housing, we see that as the biggest challenge here in Silicon Valley. That with the rising costs of rent in San Jose, they just went up 16% over the past year, with the lack of affordable housing and with potential, though, for policies and for funding, both to build more affordable housing and to provide services to, number one, prevent homelessness in the first place through rental assistance, and two, to help the homeless get out of being homeless, and three, to make sure there's sufficient inventory housing that's protected and produced. One of the programs that Catholic Charities has run actually since 1989 is our housing development arm. In 1993, we incorporated Charities Housing to build and manage affordable housing in the Valley. Right now, we have over 1,400 units of affordable housing that we have built and manage. And we are on track to develop another 1,400 units within the next few years. Now that sounds wonderful, but the need is way bigger than that. And what we're seeing is that there are people on the streets who need housing now. They can't wait 3, 5, 7 years until we get our properties developed. They need assistance now. They need to be able to get into safe and decent housing now. And the families that are struggling to make ends meet need help now to prevent them from becoming homeless, to prevent evictions. So the state eviction prevention, ends at the end of March. I mean, in terms of the help that's available. And so we're hoping that that will continue, but we are definitely going to need more help. Number one, from landlords willing to accept people as tenants, where we can help guarantee their ability to pay. And second, we need help from donors to help provide assistance for that rental assistance. And it's wonderful that we've got a number of donors who are doing that. We need more help from those donors to help get people housed. And I don't know, Bridget and Candace, if you want to speak to anything from Bridget, what you're seeing right on the street with the homeless families you're serving.
As Greg had mentioned, the need is extremely high. And for every person that becomes housed, we're seeing at least 3 more people who are entering homelessness for the first time. So the need is extremely high right now. And the challenges around getting housed are not as simple as just finding a place to go. It's all of the other in-between costs. It's the things that are surrounding the need aren't easily accessible. So when I talk about that, I'm really referencing the fact that a person needs to be employed. And a lot of these housing departments or apartment complexes, landlords are asking for clients to make 3 to 5 times the amount of income as the rent. So if you think about the average rent in Silicon Valley being around $2,800 to $3,000, you're talking about $9,000 to $10,000 a month that a person has to be bringing in. I know for a lot of us, that's incredibly challenging, right? And so thinking more about how we get people into jobs that are sustainable, helping them also with transportation. Many of our clients rely on a public transportation system that is slow, that doesn't always help them get to the jobs that they need to get to. Coming up with a deposit is really challenging as well. There's a lot of other things that we don't always think about when we're trying to find sustainable housing for our clients. So a larger conversation around this is definitely needed.
Yeah, we certainly hear so much about the homelessness situation in various cities around our country, and particularly in your area. I think maybe the next topic might kind of touch on some of the causes of some of that. What are some of the health services that you offer? I think as we were chatting earlier, I think there's some subjects there that may touch on some of the contributors to homelessness.
One of the big areas health services we provide is around behavioral health, the mental health services, both for people who are severely mentally ill, as well as older adults, and then also for children to assess and prevent mental illness by doing prevention and early intervention with children and their families before situations get more severe. The situation with so many families with the pandemic, and I think Bridget was part of this in the early days when we did the survey, we saw over 70% of the families that we were helping with food distribution express some level severe anxiety and depression. Now, this was in the early days of the pandemic. That was before it was lasting 2 years, right? And so just imagine the isolation that families have been through, the challenges that children have been through, having to do remote learning, whether to go into school or not go into school, parents losing their jobs or parents not being able to find childcare, the anxiety the parents have over their health of family members if they've gotten sick or fear of getting sick. And that has just taken a big toll on our entire community. And so as we see, it's not just the traditional behavioral health models that are important to help people. It's also a community mental health model that I think Bridget has an amazing model to talk about in terms of looking at trauma-informed responses and healing circles to help people develop healing and a mutual support so that it's not just clinicians in the classic medical model, but it's really a community-based model that relies on the strength of being part of a loving, caring community. I don't know, Bridget, you want to speak to some of that?
Yeah, happy to expand on that. Thank you, Greg. So about 3 years ago, we started parish engagement. And as the name would suggest, that's really us operating out of parishes to bring communities together and to highlight the strengths of those communities. So we started in 95122. We're still there today. It's one of the zip codes in Santa Clara County that's most hard hit by poverty. And when I talk about poverty, I'm really circling back to what Greg had mentioned at the beginning of this talk around intergenerational trauma. And so intergenerational trauma is something that our former Surgeon General, Nadine Burke Harris, had really put a lot of emphasis on in California, really talking more about the adverse childhood experiences and how those play out over the span of a lifetime and indeed over the course of a family's lifetime together. And what we see in zip codes like 95122 is that parents who are living in dire circumstances, so they're living in overcrowded housing because that's the only housing that they can afford, and they are also working 3 jobs just to pay for said overcrowded housing, and they only have 1 vehicle that they have a hard time finding a parking space for, and they have a hard time paying for food, especially with inflation prices, so on and so forth. These children are growing up in these homes that are full of chaos, not necessarily because the parents want them to be that way, but just out of nature of how it is, how difficult it is to survive in Silicon Valley right now. Those children grow up with much more or a higher number of adverse childhood experiences. We recognize those challenges. Now, that said, we don't want to say that this is that the community only has things going against them. We also know that the community has inherent wisdom, and that there is a lot that people can pull together from amidst themselves. And so when we study things like peer-based mental health, which there's a growing body of research around, we're seeing more and more that wisdom isn't necessarily coming from a high medical chair, as Greg said, or a clinician behind a desk like myself. It's really inherent to the community. What we already know from thousands of years works for our communities. Things like dance, things like singing, theater, Tai Chi, cultural kind of ways of belonging that allow us to exercise out challenges that we're experiencing and bring ourselves together and really pull together on the strength of our community writ large. So we do this in a couple of different ways through our community markets, by partnering with other major leaders in the Valley, like Second Harvest, like Martha's Kitchen, like our immigration legal services team within Catholic Charities, to try and bring the services that are necessary to the people in a space that feels comfortable and safe for them. But we also do this through a bigger process called accompaniment. And this is really the idea of bringing on volunteers, training them in the concepts of trauma and social service navigation, and pairing them with clients so that they can walk together and they can, over the course of 9 months, really help the client move not only towards their self-sufficiency goals of either getting housed or getting a job or finding affordable childcare, but more importantly, working through whatever it is, those mental health demons that are holding them back, and helping them to recognize their full potential and the fact that they have space in the society and they deserve to take up that space.
Well, I certainly have to comment, Greg, you and your team awfully good at articulating the things that you're doing. And it's very impressive, the breadth of what you folks are doing. And I personally have been very impressed by what you're doing. Is you're not just throwing assistance at the problem, you're even aiming at root causes of problems. You may be putting the Band-Aid on, but you're also figuring out how they don't get injured. Can you tell us a little bit about kind of the education services you offer?
Think about it as a cradle to career approach, that we start from early childhood through elementary, high school, and then career, helping people at different stages of their life continuously learn. So, because we know that education is so critical to breaking the cycle of generational poverty. And so from early childhood, we operate 12 family resource centers in Santa Clara County that are funded by First Five of Santa Clara County. And it's a focus on helping the parents and the children from birth through age 5 up to age 6, have the parents learn skills and approaches to helping their children be healthy and helping them learn, as well as helping the children themselves. And we do that through great community partnerships. And then building on the volunteers in the communities, the parents themselves who are receiving help often become peer volunteers as well through the family resource centers. So complete wraparound of the child, the family, and the community. And then from early childhood going to elementary school, we're helping children pre-K, TK, all the way through elementary and middle school with enhanced learning after school. So we know that so many children who have struggled with learning, difficulty with English literacy or with math and science, with the STEM approaches, need that extra help. And our amazing staff in a program called CORAL, Communities Organizing Resources to Advance Learning, CORAL, 22 school sites in the Franklin McKinley School District and the San Jose Unified School District, and helping those children find a pathway to learning and being at grade level or above grade level, which is really fantastic. And then, of course, for adults, we offer English as a second language, as well as things like citizenship classes and all of that. And then for Candace's program with refugee foster youth, there's a whole emphasis of making sure that those refugee foster youth can get to college or career tech options. I don't know, Candace, you want to mention that?
Yeah, through our refugee foster care program, we have dedicated staff working on advocacy and supporting youth through their education. A lot of times, right, youth who are coming into our program English is a second language or sometimes a third language for them. And there are a lot of barriers to formal education, right, in the United States. So we're here to support them through that process. We also work with a number of amazing tutoring programs to provide extra support to our youth. And many of our youth are successful in, completing their high school education credits and pursuing post-secondary education or vocational school as they transition from youth to young adults and on a path to self-sufficiency when they graduate from our program.
I want to ask just kind of maybe a little more rapid fire, if I can, guys, just about your organization. Your scope is limited to Santa Clara County, right?
That's our primary focus area, but some of our clients are up in the wider Bay Area as well.
Should they expect that they'll have organizations like yours? I think there's like a full number of Catholic Charities organizations, right?
In the United States, we're a member Catholic Charities USA. Every single state has a number of Catholic Charities agencies. They might be called Catholic Charities, Catholic Community Services, Catholic Social Services. It's all the same. And then globally, we're all members of Caritas Internationalis. That's the Latin, caritas for charity or for care or for compassion. And Caritas is a global network of the Catholic Church responding to humanitarian needs. And each country has a Caritas agency. So for example, there's Caritas Ukraine, Caritas Tonga.
Wow.
So wherever there's a need, Catholic Charities is there.
So what are the ways that people can help you out, how they can get involved to assist you?
Thanks, Robert. So there's 3 ways the community can help Catholic Charities, help us help our community. Number 1, definitely invest through Catholic Charities to help vulnerable families and people in need. So donate whatever you are called to give by your conscience and your God to help those most in need. And Catholic Charities will find a way to bring your donations to serve the people in the best way. The second is to volunteer. So if you have the time and the energy and the will to help any of our programs, we absolutely need volunteers in all areas. And Candace and Bridget will talk about that in a little bit. And then the third is advocate. So as people who care about families who are poor and people who are suffering or those who are newcomers to our country, it's important that our voices be lifted up on behalf and in solidarity with those who are struggling to belong, to be welcomed, and to be treated with equity and dignity and respect. And so lift your voice in solidarity with the people we serve. And I'd ask Bridget and Candace to talk specifically about what they see as some of their needs for their clients.
Yeah, thank you, Greg. The parish engagement side of things, we are always, as Greg mentioned, looking for volunteers. We have a lot of different volunteer roles and opportunities. That ranges from serving in our food distributions and helping to get groceries to vulnerable populations, to being an accompaniment volunteer like we talked about earlier on in the hour, walking with people who are experiencing those intersections of poverty. That ranges to sitting with a youth after school and helping them in their after school homework, and all the way to visiting a senior, someone who is experiencing a hard time. So lots of different volunteer opportunities. I encourage you to go to our website, find the Advocacy and Community Engagement tab, and then under it, click on Parish Engagement. You'll see a link there to our Volunteer Impact webpage, and you can sign up and register there. The second way that you can help is that if you are a listener that is located in Silicon Valley or the Greater Bay Area, and you are a landlord, we want to hear from you because we are desperately looking for housing right now for both our domestic clients and our refugee clients. We are in need of homes that are safe and welcoming and also have not only lower rent, so if that's something that you feel like you can provide, we are welcome to that, but also for folks who are willing to reduce the restrictions around renting contract. So what I mean by that is being open to rent to someone who maybe doesn't have a credit history because they're a refugee, or maybe someone who is working on getting employed and is actively involved in a program where they're seeking employment. Please do reach out to us. We want to hear from you.
Thanks, Bridget. And I'll speak about our refugee foster care program. As I mentioned earlier, we are always looking for loving, welcoming homes and families to serve as resource families who are willing to open up their doors and hearts to refugee and immigrant youth in our program. And as our youth who are in foster care, and as our youth transition into adulthood and are living on their own, we are also looking for host homes. So homes where, a family or an individual may either have an extra room that they can spare, housing units as well for low cost, but also providing a safe, nurturing place for a young adult who may need some additional support or in a home-like environment as they continue their journey into adulthood and still need some extra support.
If you're interested in donating, or if you need help, you can go to our website, www.catholiccharities.scc.org. That's www.catholiccharities.scc.org. And you can find out ways to donate, ways to volunteer, and if you are in need, ways that we can help.
What are some of those ways? I notice there's a variety of ways to donate. What are some of the examples of things that, when you hear donating, you hear people probably think money, but what other things can be done?
Yeah, so actually, donations can come, from a check or, using a credit card to, actually we have donors who donate stocks, so we're able to accept stock gifts. There may be donors that have donor advised funds, and they contact the holder of that fund, whether it's through Fidelity, Schwab, or the Community Foundation, and designate that donation to Catholic Charities. And then people may want to leave Catholic Charities in their bequest or estate plan or legacy giving. So people may want to leave a legacy, and Catholic Charities is able to encourage donors like that who are interested in a long-term value, having an impact over time through bequests or life insurance gifts. We'll even accept donations of property, real estate, automobiles. Actually, people can donate their cars, and those donations
I saw that.
to help our program.
Yeah, such a variety of ways that people can help out. In terms of volunteering, what kinds of things should people expect as far as opportunities to volunteer with your group?
So there's a bunch of different opportunities for volunteers, everything ranging from food service to visiting an elderly person to someone who is a young person in a school helping out with after school programming, to helping in our parishes in a variety of different capacities. So I encourage you to go to our website, click on parish engagement under advocacy and community engagement, and register to be a volunteer.
Okay, very good. Is there anything that you can think of that we haven't touched on? Anything you want to bring up, because we're kind of drawing to a close here?
So as we look to the future of Catholic Charities, our strategy is to help families get out of poverty and stay out of poverty. And so we are developing a whole new emphasis on family-centered community change. So all of these programs that we've talked about, imagine them all being a wraparound support for the families in a neighborhood, in a community, where we're measuring the effectiveness of those services, helping the clients access whatever resources they need. So there's a seamless welcome, there's no wrong door, and there's a pathway where they have the help of staff and volunteers walking with them on their pathway to self-sufficiency. And that's where we can definitely benefit from the community's generosity of donations, of time, talent, and treasure to walk with our families so to help them get out of poverty. Together, we can change lives for good.
I'm going to ask a question that I wonder about. Just you don't all have to answer, but if one or a couple of you want to. What does this mean to you to be involved in this organization? What does it do for you personally, as this being such a big part of your life? Just curious what that feels like.
A deeply personal question. So I started at refugee foster care about 8 years ago. And that was something that really, really changed my life in a lot of ways. I had already been doing kind of charity work for a couple of years before that, but I had never really been in an organization like this. And I made a difficult decision when my son was born 4 years after to leave the organization to go work for a major hospital in the Bay Area. I recognized right away that there's such a difference working for an organization like Catholic Charities versus working, I think, anywhere else. The people that you'll find at Catholic Charities are here because we really deeply care about what we do. And we are deeply invested in our community and in our hope for the future. No one here is here because they want a larger paycheck or because they are hoping to be president of the United States. We are all here because we deeply care about our community. And we treat each other as family, which is something that I think really keeps everyone here happy and staying.
An individual who's foreign born and learning English as a second language, working with the population of youth that I work with, I understand some of the challenges around, identity and just navigating a new culture, new country, new environment, the struggles with that on top of everything that for the young people that I work with, they're also dealing with a number of traumas, right? And just seeing the resiliency and the hope and life that they have and the potential for greatness is inspiring every day. And again, as what Bridget said about working for this agency and the people, all my colleagues, it's an inspiration. Shining light of hope.
And I'm inspired by the team and by the people we serve. I mean, they're just the resiliency and the courage that the families we serve, not just to survive, but to thrive and to seek wholeness and healing and a better life, is so powerful, so encouraging. Always go back to a quote, a theologian named Frederick Buechner. Frederick Buechner says, the place God calls you to is the place where your deep gladness and the world's deep hunger meet. The place God calls you to is the place where your deep gladness and the world's deep hunger meet. And for me, that place for me is Catholic Charities.
That's really neat. I have to tell you, honestly, in this interview, I'm not only interested but inspired by what you all have had to say. One of the reasons I asked that last question about what it makes you feel like is because there's a real opportunity for our donors and our participants to feel that same feeling. I want to thank Gregory Kepferle. We have also Candace and Bridget, who we've been talking to from Catholic Charities of Santa Clara County, and actually Candace Chen and Bridget Balahaja. How'd I do? This organization really demonstrates so much of the concept of TALRadio is all about being an information and entertainment arm of an organization called the Touch a Life Foundation, a 501c3 nonprofit organization. And the mission statement says to bridge the gap between those in need and those willing to give. And that's why we've had this conversation today with Catholic Charities of Santa Clara County. We do hope you'll take the opportunity to connect with them. Sincerely want to thank all of you for talking with me today. And who knows, maybe we'll do it again sometime soon. Thanks again. That concludes our program here on TALRadio. I'm Robert Hicks. We hope you have a good day.